Hello and welcome to the Hunger for Change podcast, where we explore the latest trends and insights in health and wellness. I'm your host, Niklas Gustafson, and today I'm thrilled to have a very special guest joining us. She's a functional medicine doctor, a registered dietitian, and a breast cancer survivor. Her passion for helping people achieve optimal health through nutrition and lifestyle changes had made her a sought-after speaker and educator in the field of functional medicine. Please join me in welcoming Dr. Elizabeth Boham to the show.
Thank you so much, Niklas. Great to be with you and all your listeners today.
Thank you so much for being here with me. I'm thrilled to have you. So, Elizabeth, could you tell us a little bit about your background and how you became interested in functional medicine?
Oh, absolutely. So my undergraduate and graduate degrees were in nutrition and exercise physiology. And so I loved nutrition. I still love nutrition. I love using food as medicine. And it was a huge passion of mine. And I was working in the field of nutrition. And I thought, oh, you know what? I want to learn more about the human body and how it all works and what I can do to help people stay well. And so I thought, well, maybe I should just go to medical school. And I didn't have any physicians in my family, so I really didn't have a good understanding of what it meant to go through medical school. A lot of people, my parents and brother are PhDs, but no MDs. So I dove in and went to medical school and I struggled honestly for a bunch of years because we were so focused on acute care medicine and pharmacology, and I had a different understanding of what my training would be like. And so it was sort of a little bit of a struggle internally, did I make the right decision and everything. In my residency, so I'm board certified in family medicine. And in the middle of my residency, as you mentioned, I had breast cancer. I was 30 at the time. I thought I was healthy and well, and thought I was taking good care of myself. I didn't have a family history. I was, so I was young, and it was, it sort of was this crazy experience that I went through that was obviously very life-changing. And I ended up having phenomenal care. I had I was in the middle of a medical school training program. So I had, physicians, they took very good care of me. I went through surgery, and I had to have, because I had a triple negative breast cancer, I had to have chemotherapy and radiation. And when I went through that whole process, I really, it gave me time to sort of reflect on where I was going and how was I going to be able to integrate my interest in nutrition with my belief in integrative care, and also appreciate the good things in conventional medicine, right? And bring it all together. Mm-hmm. And so I was very lucky. I ended up getting a position at Canyon Ranch in Lenox, Massachusetts, where I met Mark Hyman and Cindy Geyer and Todd Lepine and Kathy Swift. And that's when I went to my first course in functional medicine. And it sort of, was so amazing for me, because it sort of was like, okay, this is a great way. This is an amazing map. These are the great tools where I can integrate, true prevention, my all of the training all together and do the best care for my patients. So I've been very blessed, and I'm grateful that I've been able to find that path to take care of people.
Before this interview, I've listened to quite a few of those podcasts that you do with Mark Hyman, and they're so interesting. I realized that there are loads of them, right? I don't know how many you did, but there are many, and super interesting.
We for a while we did a lot of them, really, to try to get some, a clinical perspective. I was just in functional medicine, we are really working to transform healthcare and bring together the best of what conventional medicine has and this other way of thinking, where we're really working on personalized lifestyle factors and individual causes, because I think when we bring them together, we get the best care for our patients.
Sure. Yeah. So keeping in mind this journey that you made, what does health mean to you?
Right. So, I mean, health is it's not just the absence of disease, right? It's really just us being able to live, each individual person living their best selves, feeling joy and feeling well, and being able to contribute to the world and share their love. And so I think that what I look for with people when I'm working with them is what may be out of balance in their health, and how can we help move them along that continuum so they're closer to their optimal health, right? So sometimes that happens in the face of a disease. So people might have a chronic disease, but they can still move along that continuum toward their optimal health. And so what we're always looking for is what are the things that we need to shift for that person so they can get toward their optimal health. And for one person, it may be, doing breath work and working on calming their body. And for somebody else, it may be, their microbiome needs work so they can lower inflammation in their body and they can digest and absorb their nutrients better, for example, right? So I think that's I think what's so fun about practicing functional medicine is that we're really working to get to know that person and what can we do to help them get toward their optimal health.
Right. So in some sense, you already answered this question, but when you work with your patients, what are the most common issues that you see, and how do you approach them with treating them with a functional medicine perspective?
Right. So, it's commonalities is tricky to talk about because we are all individual, right? And when we work with a patient, we look at their matrix and how all the different systems in their body are interrelated, as well as their lifestyle factors and their genetics. And so we see there's so many different common things we see, so it's harder to put your finger on. But what I will say from a nutrition perspective, right? Or if there's a few things we see very often. One is we see a lot of people that have signs of insulin resistance. So that's like pre-diabetes, and we can talk more about that, but it's unfortunately so common today that we have people with metabolic syndrome that leads to everything from heart disease to fatty liver to cancer, to fatigue, to weight gain, to dementia and Alzheimer's disease and hypertension. And, so that is a very common issue that we're dealing with worldwide because of multiple things: crummy diet, lack of exercise, not enough lean muscle mass, poor sleep, toxins, probably the microbiome, right? So that's one thing that's very, very common that we are always working on. And then the other thing that we see a lot is issues with malnutrition, actually, which is sort of interesting because you think, and especially we have a pretty well-versed, well-educated patient population. So you'd think, well, you're not going to find a lot of nutrition deficiencies, right? But because people have such good access to food, but we do, we see some nutritional deficiencies that are, or I should say even insufficiencies, right? Maybe not to that deficiency place yet, but insufficiencies where people are not getting optimal levels of protein in their diet, or they're not getting optimal magnesium because of what foods they're choosing and how their food is grown, right? Or
a lot of processed food, right?
Yeah, a lot of processed food, and just our soils becoming depleted in minerals too. So we surprisingly see issues with nutritional insufficiencies, and I guess it's also an area, as I mentioned at the beginning, of a passion of mine. So I'm always looking, and when you start to look, you start to see some of these insufficiencies as well.
So what you just mentioned, insulin resistance, one of the consequences is obesity, right? And obesity is something that we see is growing a lot all over the world, not just in Northern America, in Europe, but even in Asia. Recently, we see it growing a lot in China and India, right? So when we try to get to the root causes of obesity, how can we, through functional medicine, how would your approach be to try to get to the root cause of obesity?
Absolutely, Nicholas. It's so important for us to expand our view on obesity, right? So, in conventional medicine now, a big push is medication, right? So, like, you say, oh,
Right.
someone's obese, we've got to start this Ozempic or some medication right now to try to get the weight down. It's what's really, really important is that we start to have some different conversations so we can really do some true prevention and not just even early detection or early treatment, which is important, but we've got to do some true prevention. So there's so many angles for us to sort of talk about, but the first I think is with our children. We know that when kids gain weight young, they have a much, much, much harder time maintaining a normal weight when they're older. And so it's important that we work with our kids with that pediatric population and get them, feed them the right foods, that are, taking away the high fructose corn syrup, taking away the
Yeah.
juices, all the extra
Mm.
sweets, the refined and processed foods, change our whole relationship with celebrations and parties at school where a lot of junk food is often provided, which is causing a lot of problems for our kids as they get older. And then the second thing is with our kids is just working to increase their lean muscle mass. If they're not getting enough exercise, then again, that lack of lean muscle mass that gets established so easily when we're kids, then they're going to live with low lean muscle mass their whole life, which just is so difficult for their metabolism. So I think,
Yeah.
that's really true prevention. We need to be having those conversations about changing things. We also appreciate the fact with obesity, there's so many levels to this, right? We've got a toxic food supply, which makes it very easy for people to gain weight because they're refined and processed carbs that people are not burning off, and so they just get turned into fat. We have a lifestyle where we're not doing enough exercise or activity or movement to burn off those calories, right? So it's a big conversation. When I
Right.
work with individual patients, the other issues that we really focus on are toxins and the microbiome. So toxins are fascinating. There's so much really interesting research looking at toxins and how they can trigger insulin resistance and obesity. So even things from BPA, right? That hard plastic has been associated with insulin resistance and weight gain. And we know that even
Yeah.
like Agent Orange, right? They know that men that were exposed to Agent Orange had a much higher rate of getting diabetes, even with the same amount of weight gain, right? So we know that
Yeah.
toxins are involved in our metabolism. And the other area that's fascinating is the microbiome. I mean, we need so much more research here, but it's really fascinating to see how when there's imbalances in the microbiome, that can be also a trigger for weight gain, obesity, insulin resistance, non-alcoholic fatty liver disease. And so
Yeah.
those are some additional areas we'll explore with our patients as well.
Yeah. So, and when you mention higher fructose corn syrup, you mentioned processed carbs. What about seed oils? Because recently we hear a lot about seed oils and how bad they are for your health. What is your professional take on that?
Yeah. So, so you mean like a vegetable oil, right? We're more pro-inflammatory, not that stable. You really want to be getting your fats from real food. And, from an oil perspective, my favorite is the extra virgin olive oil or coconut
Yeah.
oil,
Yeah.
as opposed to the seed oils. Yeah.
Exactly. Yeah, because they're not seed oils, right? They're the coconut and the olive, which is actually fruit. But the problem with the seed oils is that they come from seeds, and seeds are also full of anti-nutrients. They're not supposed to be eaten, right? So yeah, I mean, we hear more and more that they are actually even worse than the refined carbs and the sugar, which is, I think, very interesting too. Because when I was young, we, even in the 70s, we knew that sugar was poison. You know, we already knew that, but you never heard anything about the seed oils. Like in Sweden, we had a lot of sunflower and also rapeseed oils, and they were supposed to be the most healthy fat that you could have. You know,
You're right.
polyunsaturated
They
fats
were
that,
marketed as that healthy alternative. Such a
right?
it's a great point about how this is what happens in nutrition. Every time there's like this new belief, then it gets marketed into this fake food that gets pushed.
Right. Yeah. Like fake meat is being right now.
Right. Right.
Right. Yeah.
Exactly. And so it is really important for us to always get back to the basics of just real food, not
Totally. Yeah.
processed, pulled from some other area, right? That's a very good
Total.
point.
I totally agree. Actually, I believe that the fake meat is what margarine was 50 years ago. When I was a kid, margarine was that what you should eat. No butter, but margarine. And a lot of people actually believe that was the healthiest oil, or the healthiest fat that you could have.
No, you're right. When I was growing up, it was the same thing, right? It was like, don't have the butter, have the margarine. And then we realized it was the worst thing we could have done, right?
Right. Yeah.
So yeah, we often get off track with nutrition. And I think a lot of that then gets, with marketing of processed and
Yeah.
products really then takes over and has this whole, you know, um, world of its own. And so it's really important. I think when people get confused about nutrition, you always just want to think about nutrient density and real food, so always think about,
Totally. Yeah.
right? Those are the things that I think, because you can have people have conversations and debating about this amount of protein or protein from this versus this. And, there's so many conversations people have, but essentially it's like whenever you get confused, I say, just think about, is this a real food, right? How ultra processed is it? Does it make sense that
Yeah.
that this is a high fat food that should make an oil, right? Or and is how nutrient dense is it? So unfortunately, what happens is, if we're wasting calories on refined and processed foods, like let's say I'm going to say a Pop-Tart, right? I mean, like, just like there's so many calories, but no nutrients in it, as opposed to having real food, where you have brown rice with salmon and broccoli, right? And mushrooms, you've got all sorts of nutritional density in there. And so just always think about real food.
Yeah. Yeah. Which reminds us of how powerful the food industry is, like with their lobbying, with their marketing, which messes you up. You don't know what to think. Is it healthy to have a fruit juice that is like contains 5% of orange, and the rest is just sugar and water and additives? So it's really hard for people to choose between what is processed and what is not processed. It's not that easy.
Correct. And so often you're right that foods get marketed as, okay, this is healthy because it's a whole bunch of blended up fruit in a bowl, right? Which, sounds very healthy, but if it's going to spike your blood sugar, then that's not going to be good for you. And you're going to get hungry a few hours later, right? So
Exactly.
It is really confusing for people. You're right.
It's very confusing. It spikes your blood sugar, and then it contains no nutrients really, because it's not real food. So getting back to children's diets, and because I mean, it's you as a parent, you at home, it's okay, you choose what you want your kids to have, but then when they go to school, they go to parties, they see their friends, and they also might get confused because they see that other kids, they don't eat what you get at home. um, what would you say, what is your take on that? How should you explain to your children that what you give them is for their best, and that this is real food, what you get at school is not perhaps that nutrient dense? It's not that easy.
No, it's, you make a very good point. And I think as kids get older, so when they're in their tween and teen years, it really is about balance and it's a delicate balance because if you're so strict, that often backfires. And
Right.
what I try to do with my kids, and what I try to have my patients do, is when they're working with their kids, is just be honest and have those honest conversations. Like you said, okay, this is why we're having this meal. We're having a meal that has good source of protein, a good source of fat, and a lot of fiber to balance your blood sugar. It's more whole food. And that's why we're reaching for it, because sometimes if you eat this, pizza, for example, you won't feel as good, or this might happen. But to say no about foods, and get really strict about it, often backfires. So it is a very tricky balance that you want to have. You just want to have those honest conversations and provide the best food you can, and get your kids interested in food and cooking and food preparation.
I totally agree. To get them to actually cook with you, and to understand what vegetables you use, and why do you use, and what fruit you use, and why do you use this, and to get them interested and motivated, and to actually think that it's fun to be in the kitchen all together. I think that's very important. So what would you say? What are the practical steps that you would suggest if you want your kids to have like a sustainable view on a healthy lifestyle?
Yeah. I think the first thing, like we just said, is get them involved in deciding what meals you want to have. Of course you'll have input in it, but having those conversations, getting them involved in the food preparation, and getting the food. It's very important that we work on getting them active every day, getting your kids outside, involved in sports or activities that getting them to build that lean muscle mass. We need to focus on sleep. It's so critical, and so often our kids aren't getting enough sleep. So it's really, really important to make sure that there's enough time set aside for them to get good sleep. So the recommendation for sleep for adults is 7 to 9 hours a day, but for kids it's higher than that. So depending on their age, when they're really little, it's 14 hours, right? And then it goes to 12 hours. And then at some point it's 9 hours when they're in their teenage years. But what that means is that they've got to understand that we need to work back and get to sleep early enough, put the phone away, get the screens turned off, so you can calm down and get to sleep early enough so you can get that restful sleep. And then I think the other thing that we have to do with our kids is really give them the tools to manage stress. And I don't think we've been doing as good a job there, right? So we need to give them the tools to, calm down their body, integrate breath work into their day,
Right.
the yoga, meditation, the stuff that they will need to be successful in life.
Interesting. Yeah. When you mentioned that it's important to get your kids involved, even when it comes to where does the food get from, where you get it from. That makes me think of I know that you're from Massachusetts, and I did a trip to Nantucket Island with my oldest sons. I have 4 sons, but they were maybe 13 and 11, and we went out for this fishing excursion, and it was just amazing. I think it was like west part of Nantucket Island. We went to fishing. It was kind of sea bass, and we got so much like in a couple of hours. I think we got 80, like these huge sea bass.
Wow. Wow.
They thought it was amazing, and since then we haven't been able to repeat that experience because they never saw that much fish in their lives. Neither did I. You know, it was just amazing.
That's a wonderful experience. Absolutely
Yeah,
right. Where is the food coming from? Visit the farms or do farm some yourself, have a garden, grow some food, get involved in understanding the local
right. Yeah,
farmers who are growing your food and support them. That's really, really important.
exactly. And to get closer to nature. In this case, it was like they understood that fish is not something that you grab in the freezer in the supermarket. The deep frozen fish blocks. This was actually to hunt. I think that was just amazing.
What's so great also about the closer we get our food to its source, right? The
Mm,
less processing that's involved, the less packaging will be involved. And the
totally.
less
Yeah.
packaging is involved, then the less toxins we have exposure to. Because we're learning so much about toxins. We talked about how it impacted weight, but of course we know it's involved in cancer risk. So when we
Mm,
think about all the plastics on the food and packaging, the closer we get to nature, right, the less we're going to be exposed to all that packaging. And so, think about it,
exactly.
every food that you're picking up, think about, how can I get this closer to its real source?
Yeah, I agree. And also, how these toxins affect your gut health, right? That's also very important.
Yeah. Yeah. I mean, we're learning so much about glyphosate, right? So glyphosate,
Yeah,
the herbicide, is definitely has been associated with damaging the intestinal permeability, right? It can damage the
yeah,
microbiome and impact the permeability in the gut, right? And so what does that mean? So, that may then make it easier for us to get exposure from toxins from the environment into the body. That may then be cause more inflammation in the body when there is
yeah,
increased intestinal permeability. And so, and then of course the damage in the microbiome, and how is that impacting then risk of bloating and
yeah,
imbalances in the microbiome, dysbiosis, SIBO, irritable bowel, and
yeah,
inflammatory disease, right? So it's an interesting connection that we know, and of course we need more research in this area, but I think we need to
mm,
appreciate it and acknowledge it, because then that helps us decide to make some changes. Okay, I'm going to choose organic whenever I can. If I'm going out to eat, go to restaurants that are using organic foods more.
mm, mm, mm.
I'm going to make that choice myself. We're going to work to change policy so we're not using these toxins as much in our environment, because we are recognizing they're really impacting our health.
Yeah, and today's wheat is such a cocktail between the gluten and the glyphosate, right? And sometimes you don't know what's worse for your gut. Is it the gluten or is it the glyphosate, or maybe this combination, which makes it so like lethal cocktail?
Yes. Yes. So I think it's important that we really are paying attention to these herbicides and working to change policy and change
Mm,
how we're growing our food.
I agree. So okay, so if we go back to the challenges with the diet, our children's diet, and the um, because recently I realized when I follow podcasts and read articles that um, child obesity can also lead to hyperactivity and all kinds of issues, in our children. But the relation between child obesity and hyperactivity, what is your professional take on that?
Yeah. Well, it's a very interesting thing to think about. So if somebody comes in to see me and it's a child, and the child is overweight or obese and is hyperactive, What I think about right away is saying, okay, I have to make sure this child does not have sleep apnea. Sleep apnea is a process where kids or adults are having these apneic episodes at night. And so what that means is that there's periods of time where they are not getting oxygen into the body. So there's a closure of their airway. Their airway gets blocked, either because in kids, it can happen because of these adenoids or tonsils, or if their neck gets too big, or just the structure of their oral airway. Adults, same thing, just not as much with tonsils and adenoids. It's more just like, your anatomy, or you've gained weight. And so what happens is the airway gets blocked off. And that process where the airway gets blocked off can happen 5 times in an hour. It can happen 30 times in an hour. It happens very frequently. When that happens, when the airway gets blocked off, the body's not getting oxygen, and the body then gets all anxious. It's like, oh no, I need oxygen. So the body wakes up. The person doesn't always realize they woke up, but their body actually wakes up to get a big breath of air. Okay. So they can get oxygen. When that happens, your sleep is disrupted. So every time that happens, your sleep is disrupted. If you were in REM sleep, it gets stopped. You get disrupted. And so what we know about sleep apnea is that it is associated with attention deficit disorder, right? Of course.
And that probably raises your cortisol levels as well, right?
Absolutely. Raises your cortisol, raises your insulin levels, raises your inflammatory markers. They can measure things like TNF alpha that gets higher. So all of these markers of inflammation increase, and insulin increases, ghrelin increases. So then as a result, with the insulin that's high and ghrelin that's high, weight gain occurs. So often sleep apnea triggers weight gain. Sometimes we think, oh, somebody has sleep apnea because they gained weight, but often it's because they have sleep apnea, and that is a
it's the other way
process
around.
triggers the weight gain. So, and as we talked about, it's associated with attention issues. So with a kid that's overweight with attention issues, I'm wondering, we've got to rule out sleep apnea. We have to make sure that that's not the reason. And then the other thing,
No, sorry. I was just going to ask. So what would be your solution to that? How do you solve that issue?
Right. So it depends on why do they have the sleep apnea. If they have sleep apnea because of, in kids, a lot of times what surgeons, ear, nose, and throat doctors will do is they'll take out tonsils, or they'll make some extra room in the airway so that they don't have sleep apnea. In adults, we sometimes use a CPAP machine which gives pressure to open up the airway so that they get oxygen and they don't get those apneic episodes. But when we're talking about that, obese child, the other thing sometimes that happens is if they're having foods that are causing their body inflammation or allergy, we can remove some of those, and sometimes that all calms down. So I've had parents would said to me, their child is snoring, right? Which can be a sign that they may have some apnea. And then we pull away allergens. So depending on, for that kid, some kids are allergic to dairy, some kids are allergic to gluten, some kids are allergic to, right? If we pull away some of the allergens, sometimes that calms. We also have to think about environmental allergens as well. The other thing you think about is about the quality of the diet, right? So, you make sure they're not getting any soda, any juices, right? You make sure they're not getting any food coloring, because food coloring for some kids can trigger focus and attention issues. And so you're really looking at the quality.
I heard so as well. Yeah, the coloring could be really bad for you, bad for your kids. So in conventional medicine, I heard that in Sweden, the last number I saw was that 9% of children between 7 and 14 years old do have some kind of hyperactivity, ADD, ADHD, which is it's a number that is like double the last 5-6 years. It's crazy. So in conventional medicine, people tend to medicate. What is your take on that? Medicate, or would you try to find the root cause and go from there?
Yeah, so I absolutely am looking for the root cause. I mean, there are times where people benefit from pharmaceutical medication, but in functional medicine, so in conventional medicine, we go, okay, this is what's going on. We're seeing some attention issues. Let's just let's use medication to get it better. What we do in functional medicine is we say, okay, we see attention issues. Well, let's try to figure out for that child, why is that going on? Because for one child, it may be a crummy diet, right? So they may be not having enough protein in their diet. Whenever they, for breakfast, they may have a muffin and banana, for example, but there's no protein there. There's not enough good fat. And so that makes it very hard for them to focus at school. So if we, it may be diet related. It may be like we talked about the food coloring. There are some kids that have attention issues with gluten and dairy because of these components called gluteomorphins and caseomorphins. So we start to say, okay, what's going on in the diet? Are they getting a diet that's rich enough in omega-3 fats, those anti-inflammatory fats, which come from, from ground flaxseed, it comes from walnuts, comes from sardines and salmon, the high fatty fish, right? Those omega fats are so important for brain health. And so you want to make sure, okay, is it diet related? You may have another kid that it's related to sleep. Maybe they've got sleep apnea, like we mentioned, or they're only getting 6 hours of sleep a night because they're playing a video game till midnight.
Exactly.
Right. So then you've got to say, okay, for that kid, we've got to really
too much screen time before sleep, which is really bad for you.
And I'm sure, right, we can't deny the fact that we're all spending too much time on our screens. So that it's impacting attention issues for our kids as well as adults. And we've got to really think about that as what we're all doing in terms of we got to get outside more. We got to put our phones down. We've got to act with nature. We've got to, we've got to get some of that sunshine like we talked about.
Yeah, that's super important, right? Yeah. So all these lifestyle changes are so important for our children, right? As for us.
It's important to sort of personalize it because you've got to figure out for that child what's going on.
Interesting.
The other thing we sometimes see, some of the nutritional insufficiencies, I'm going to go back to protein again, because it is something to see, right? We need our protein, which gets broken down into amino acids. Those amino acids then are used to make our neurotransmitters, right? Which are really important for focus and mood. And so if we're not getting a meal that's rich enough in protein, or if we're not digesting and absorbing it well enough, and all of those things can cause some insufficiencies, which can have an influence on somebody not being in their optimal health.
Exactly. So if you don't get the nutrients, enough nutrients from your meals, would you recommend supplementation for kids? Supplementations, just like your tyrosine, or I think there are 2 or 3 that they usually recommend. What is your take on that?
So, I always want to go food first. Like if I can fix something with diet, I want to go food first. But there's a lot of nutrients that we're not seeing as much. We see it's harder to get from diet for certain people, whether it's their food choices or just what food is available to them. And so there are times we definitely use supplementation, but it's very personalized, like, okay, for that person. So you mentioned tyrosine. Tyrosine is an amino acid that helps with the body making dopamine, which is really help with focus and attention and mood for some people. So there are combinations of supplements out there that have there's some that have a combination of like tyrosine, taurine, tryptophan, and that's kind of a balanced amino acid that helps with with brain health. I guess I should put it that way. The
Yeah.
other thing that helps kids a lot is neurofeedback. I think neurofeedback's a really cool practice. I don't do it myself. I'll send people to go see a practitioner who does neurofeedback. And, through EEG waves, they'll measure brain activity and then have the child do different exercises, which helps with focus and attention and sometimes mood. And so it's a really powerful tool, I find.
Okay, interesting. So you mentioned this processed foods with high fructose corn syrup, etc. The kids today, well, not just the kids, everyone, we get used to consume sweet food in general. Everything has sugar. Most processed foods have sugar. So being used to that everything tastes sweet, then trying to fix that, adding artificial sweeteners, that is very common today. Like, not just diet soda or ice cream, but everything. We see artificial sweeteners in everything these days. What do you think about artificial sweeteners? Should we just try to switch from sugar to artificial sweeteners, or is there another way to solve this?
Yeah, I'm concerned about artificial sweeteners. So when we're in that category of artificial sweeteners, we even have the natural low calorie sweeteners too, right? That we could have that conversation about too. And I think that the first thing, and you mentioned, and I feel like this is very important, is we just want to work on changing our taste. So the more we're used to always having that sweet taste, it's going to be harder and harder to eat real food. So I think that's number one. And we do see in the US, I think 65% or more foods in a grocery store have sugar added to them, which is crazy. Which is crazy.
Yeah, it's crazy. Yeah.
So people are, like used to having this sweet taste, which, then just throws off our taste buds and what we think tastes good, especially what we were growing up eating. So
and I have friends that they don't like to drink water because water doesn't. They want this sweet taste every time they drink something, some kind of soda or juice or whatever. But water is just not good enough for them. I mean, and that's really crazy.
I'm really concerned with our kids, with all of these sports drinks, right?
Yeah.
I don't know how popular they are in Spain.
Sports drinks and energy drinks that even contain caffeine. That is crazy.
Right. Like we need that. We don't need that. We need this to get a good workout. It's crazy. So right. So all of those sports drinks that, again, that comes back to the first point we made, right, or early on in the conversation about the marketing, right? It's marketed as this is necessary for you to go do this sport. You need to drink this sports drink with all of this extra sugar and food coloring or whatever's in there, right?
Yeah.
So first of all, we just have to sort of step back and pay attention. In the US, right? Also, coffee drinks have just exploded, and there are places where people get tons of added sugar and junk, right?
I know.
I'm very concerned about artificial sweeteners. I mean, there's never been a study to show that they help people with losing weight. So they might not have calories, but they definitely are impacting the insulin receptor.
Right.
Taste receptors in the gut. They are not good for us. They are associated with increased risk of diabetes. So then people ask me about, well, what about stevia, right? Fruit, I mean, those are things where you go, well, they're natural, they're not artificial, but they're these high sweet, low calorie foods. I try to stay away from those as well. Like that's just where I recommend people go, because.
So are you talking about the real stevia, the leaves, or are you talking about the synthetic steviol, as we say in Europe? Or are you talking about both?
You're making a very good point, right? So the more processed it is, then it's more
Mm,
concerning. But we do want to think about, how much is added to a food, and is that what you really want to be having on a daily basis? Um, you know, I mean, I think it's an area that we need more research and we don't know enough about, but I think we have to ask
mm.
the question,
Yeah.
in terms of
Yeah.
doing to the microbiome, how is it helping us? Do we need to have this on a daily basis? And always
Mm.
think about, can I go towards something that's less processed,
Totally. Yeah, I think we agree on that. What we need to teach our body is that everything doesn't have to be sweet. We need to like lower our, um, not to be get used to that everything needs to be sweet all the time, and sometimes you don't need that. And also when you start to consume less sweet, less sugar, and even less artificial sweeteners, then you get used to that, and then you feel like that's enough,
Yep,
right?
absolutely. And the same thing happens with caffeine too. Like you mentioned caffeine, we sort of start to get used to having this certain level of caffeine. And for
Yeah,
some people that over time, it ends up being too much, and that can cause more anxiety, trouble with sleep,
yeah,
adrenal fatigue, wearing the
it's
body
an
out.
addiction. Yeah, yeah,
Becomes,
becomes an addiction as well. So okay, so we covered all kinds of health topics here, and if we go back to the basics, um, what does it mean? I mean, if we talk about in functional health and functional medicine, what does it mean to get to the root cause of disease?
Hmm. So, I think that's a very good question to talk about and to think about, because sometimes people get frustrated when we don't get to the root cause, right? So they'll
Mm,
come, they'll say to me, but I thought we were going to figure out why I got this cancer, right? And and I remember when I had cancer, I wanted to know why. And did I ever figure out exactly why and know for
mm,
sure this was the reason? No. So I
mm,
think that it's important to recognize that we work to understand what the root causes may have been or may be, because that helps us determine how best to treat that person and what do they need to shift in their lifestyle or in their
mm,
systems in their body to get them healthier. But it's important to recognize that we don't always figure out exactly for sure this was the reason,
yeah,
because that can be really frustrating for people when they feel like, well, you promised or you said we'd figure it out. And I mean, what I think is amazing about medicine is that it is, the more we know, the less we know. And
yeah,
we're just trying to get to, I mean, making the recognition that there are root causes is important because that helps us determine how to treat somebody. But also recognizing that we don't always figure it out, or there's a lot of
no,
times we just have, we have, okay, we know this is going to help you, but is that the actual root cause? Sometimes it's tricky to always figure out, but we want to take into account your genetics, your lifestyle, the systems in your body, and how it all came together to influence your health.
mm, yeah, yeah. I agree. So I think it's about time to wrap this up. It was so interesting to talk to you, Elizabeth. Um, is there anything that you would like to mention that I think you think that I missed out on?
No, Niklas, this was a great conversation. It's been wonderful being with you. If people want to, learn more about what I do, I do have a free ebook that talks
Yeah.
about breast wellness. It's on my website, drboham.com. And, they can follow me on Instagram, Elizabeth Boham, MD, or Facebook. And, but it's really been, it's been a wonderful conversation. Great to be with you.
Yeah, yeah. So happy to talk to you, and thank you so much for your time. So I will keep listening to your podcasts and following you on Instagram and also on YouTube. Thank you so much for being with me today. Thank you so much for listening to the Hunger for Change podcast. I hope you get value from the conversation with Dr. Bohm. I also wanted to take a moment to talk about Naturally, my brand of healthy food products. And naturally, we are on a mission to change the world through what we eat. This is why we worked so hard to make products that are delicious and also good for you. They're all gluten-free and have no refined sugar. My personal favorites are the cheesy snacks, chocolates, and cacao hazelnut spread. We also have kale chips, granolas, nut bars, nut butters, and protein powders, as well as many cool snacks to be released this year. At the moment, Naturally is only available in Europe. You can head over to our website naturally.com and it will take you to our online store. If you're in Italy, Portugal, Germany, Poland, France, the Netherlands, or Sweden, you can find them in Amazon. Search for Naturally. I will leave all of these links in the description anyway so that you can find them. Thank you so much for listening and stay tuned for the next episode.